If you work in health IT, either on one of the technical teams or with clinical applications, there's going to be a point in time when you need to move some configuration into production. And any changes that go in need to be controlled and approved before they can move into a live patient environment. But that doesn't mean that every change goes through the exact same approval process. Organizations all have their own specific criteria, but in general, there's 3 different categories of changes that are managed through change control: standard, regular or normal changes, and emergency changes. In this video, I want to provide some examples of what might fall under each of these 3 categories, as well as what really the differences are between them. If you've seen my videos before, welcome back. And if you're new here, my name is Dre. I'm a health IT consultant who's been working in health IT for over 20 years now. So let's start with standard changes. For these ones, the key concept is that the organization has done these types of changes before, usually many times, and there are clear parameters around when the standard process can be used, the steps are clear and well documented, and there is a known or expected outcome. So if you were to have these standard changes put through a full review process, what you would essentially be doing is having your approvers review the exact same thing and approve the exact same steps over and over again repeatedly. So as you can imagine, that will take a lot of resource overhead. And if you do have, in fact, the exact same parameters and steps and expected outcome every single time, there's really little for them to consider and evaluate before approving. So instead, the process for these ones itself is pre-approved, and as long as the activities are going to fit within the very clear defined parameters and process that have been set out, then what needs to happen before they can move into production will follow a standard plan. So for example, if you're going to add a new medication to the formulary, there might be a clearly defined process for that to occur, and those may be able to go into the production environment after following the approved configuration, testing, and implementation steps. The process is going to be repeatable, and the results are reliable each and every time they go into the production environment. Another example might be adding a new provider. So the configuration steps, the validation points, as well as the process are all clearly defined and can be repeated time and time again. Now, standard doesn't always mean small change, so those 2 examples that I gave you are fairly small, but there can be larger changes that are identified as standard. What it really means is that the process is known, it is repeatable, and it has been proven to be reliable, and it's going to follow a consistent pattern over time. So the next one we have is regular or normal changes, and these ones are going to have a full review process. So this might be to confirm that it behaves as expected in integrated environments and that it passed all the testing requirements, that there is a clear implementation plan laid out, that there is communication to end users plans, that there is a backout in place, and that there's consideration taken as to when this is going to go into the production environment. So normal changes are usually evaluated by a number of people, particularly when they are in integrated environments. And most organizations will also have some sort of change control meeting where they are discussed and presented in a way that people can ask questions when they're evaluating before they provide their approval. So an example that might fall in this category would be adding a net new lab test. There are components around the ordering, the result components, of course, the interface if it's a different lab system. There are considerations for reporting and dashboards, as well as different nuances when it comes to middleware and analyzers. So there's a lot of moving parts here, and that's not going to be the identical moving parts and the identical parameters for every single lab test that comes forward. It's going to really depend on what that lab test is, what it's used for, and what type of equipment and applications it's going to interact with. So another example might be adding a new component to a dashboard that is being pulled in from a structured note in ClinDoc. So the group is going to want to look at where the information is coming from, whether it has been appropriately integrated into all of the logic that's in that dashboard, whether the information that's now being collected or added and pulled into the dashboard needs to go somewhere else, whether it's triggering things, if it is involved in regulatory reporting. There's a lot of different sort of layers and teams that would be involved. So that would, at most organizations, typically be presented as a normal change. Now, of course, like I mentioned, every single organization is different. So if any of these examples sort of don't fall into that category in the organization you're in, it doesn't mean that they're in the wrong category. It just means that the way things have been defined, documented, and outlined in the processes that are followed are a little bit different where you are. The final one we have is emergency changes. So with these ones, it's the urgency that actually changes how it's handled, not necessarily the evaluation that's put around it and the approvals that are required. Emergency changes need to be put into the environment quickly so that they prevent imminent harm or so that they can restore service that has been disrupted for end users. They still follow an evaluation and approval path, it's just done in a very expedited manner. Depending on the situation, you may obtain verbal approval. They may be in emails or messaging threads with leaders, or you may even receive formal approval documented after the change has already gone into production. So that doesn't mean that they're not tested. It doesn't mean that there's not all of the parameters and stuff around it to make sure that it's safe and that it's known when it's going in there. It just means that it has to happen so quickly that there is a likelihood that some of the formal documentation and some of the detailed steps might be written after it happens. So these are also very clearly defined for organizations, and each organization is going to determine what criteria actually need to be met before something can qualify as an emergency change versus a normal or a standard change. So an example of this one might be a security patch that went in and inadvertently caused the application to throw an error message in one particular function when a specific workflow was followed. In order to correct it so that clinicians can get back to providing care, there needs to be something put into production right away to remedy that error. So a lot of the organizations that I have worked with over the years will actually take the first couple minutes at their weekly or bi-weekly change control meetings to discuss any of the emergency changes that went in so that they can get that broader set of awareness. So it's not so that people can evaluate whether it should go in or not, because of course it already happened, but it is just to let everyone know that this is what happened, this is what was done to remedy it, and it gives them an opportunity to ask questions or to realize if there is anything else that might be tied to that that could have been missed when it went through that rapid process. One of the other change things that is worth mentioning, especially when we're talking about normal changes and emergency changes, is changes that occur with project work, particularly immediately after an implementation when you're in a hypercare or a warranty period, and there may be a very high volume of things that need to be updated. So in these particular situations, it is extremely rare to have an organization treat the changes that go in during that period as all under an emergency blanket. More often than not, what actually occurs is they take the normal process and the normal sort of approval reviews, the meetings, the discussions, and everything that occurs, and they just speed up the process for that short period of time. So instead of having a change control meeting once a week, they may have a change meeting every single day. So when you're trying to figure out what type of change that you're dealing with, don't just look at the volume of work that's required to do that change, because that's really not what's driving the category that it's going to fall into. You're looking at whether it is a standard, defined, repeatable process that follows the exact same parameters every time and has been approved in your organization as something that can go through as a standard change, whether it is something that may have multiple teams involved and slight nuances attached to it, or something that hasn't been done before and needs a broader set of evaluators and approvers so that it goes through as a normal change, or whether it is to prevent imminent harm and immediately restore service for something that has been disrupted and needs to follow an emergency change path. Your organization's change policy is going to tell you exactly what you need to do for everything. It's going to tell you where all the rules are and what needs to be documented, where things need to be tracked, and all of that stuff. But I just wanted to give you guys a high level overview of what the three categories are, what kinds of things are going to fall into them, so that you're aware to look for them when you start your career journey, or if you're going to a new organization and need to sort of figure out how it works. I hope it was helpful, and I will see you again next time.